Welcome to the next episode of the Conscious Physician Medicine and Psychedelics podcast. I have a very special guest here today with us, Dominick Zurlo, who gotten to know, had the pleasure of getting to know over the past 8 months or so. It's been more,
Yeah,
probably since March of 2025, March, April of 2025 through the Psilocybin Medical Act. SB 219 was signed as a bill by our governor in New Mexico. And we are here capturing history and also really showcasing that you can be a pioneer in this field. And there are many different ways of going about creating therapeutic environments for these medicines. And so with that and so much community heart in what we're doing here. So just capturing really history. So Dominick, please take it away. Tell us who you are and yeah, tell us what your experience has been so far.
great. Well, thank you, Lita, and thank you for having me on the podcast. This is fantastic, and I'm really glad that we're able to get information out to people. And it's been a very interesting time over the last year and a half to 2 years since really working on this project. But my work with regard to substance use and psychedelics actually goes back decades. I originally started out as a student employee at the University of New Mexico Center on Alcoholism, Substance Abuse, and Addictions, working with Dr. Bill Miller, who many people may recognize with regard to motivational interviewing. And so, really working on some of those initial projects, looking at how do we actually reach people? How do we get treatments and modalities that actually fit for individuals rather than forcing people into a particular mold? And so, I really started with that. But at the time, I was looking at being an anthropologist. And so, but really with regard to working with substance use and also with epidemiology really captured my attention. So while I did finish my undergraduate in biological anthropology, a lot of my work has actually been in the fields of substance use, and especially in the area of harm reduction. And so here in New Mexico, we're very well known throughout really not just the country, but internationally for some of our harm reduction programs. And I had the honor to be able to be a large part of that and help with building some of our programs, including syringe services, overdose prevention. New Mexico, for example, we were the first state to actually allow for the distribution of naloxone, which is the medication used to reverse opioid overdoses. We were the first state to really do that, to be able to give it out to people who were actively using opioids. And so I was a part of that training. How did we get that curriculum across to people? How do we teach people, and not just teach people in buildings, but how do we bring it to them? So, really using the harm reduction adage of meet people where they are. We need to figure out how do we meet people in order to help them. And what help do they want? What are they ready for? Not forcing something onto people. And so I really came up through several decades, although every time I think about how long it's been, I don't want to think about that aspect, but it's been a long time. And really looking at how much work we have done in those areas. And then one of the other things is I had the honor of being able to, when I moved to the Department of Health in the mid 2000s, is really getting to be a part of the development of our brand new medical cannabis program. And what really happened at that time, there were only a few states who had cannabis programs at all. And so we were one of the early adopters. And we also, in this area, we were the first state to actually license cultivators. And so that really was, I mean, quite frankly, we were learning so much at that time because nobody had done that. And because cannabis was a Schedule One drug and still is at this current time, although there's some changes happening in that area, hopefully we'll see some more soon. But with that, we had this dichotomy between something that was illicit on a federal level and that was legal on the state level. And so we had to figure out ways of how to actually manage that and do that. And I think that we've actually done very well with regard to that. Many of the ways that we were doing things have been utilized in other states and other areas. And so I'm very proud of that fact that we were able to do it. But what it really did is it helped me to learn more about not only how do we do new programs, but how do we work with programs where there's so much stigma. and where people, you're using something from a medical standpoint that we have lots of data on and lots of information on, but people kind of say, oh, that's illegal, so we can't do it. And so what I see really having happened is we've moved a long way. We still have a long way to go. There's still a lot of stigma with regard to utilizing cannabis for medical uses. And now, 2 years ago in 2024, we had a Senate memorial to look at psilocybin as a treatment. And a lot of people have kind of said, oh, well, that's new. No, there were efforts on this for several years. And I can tell you in the harm reduction world in New Mexico, at least, we were talking about things like ibogaine and psilocybin and other psychedelics back in the 90s. And so this isn't really new. It just sometimes for some people seems new because it's the first they're hearing about it. It's the first time they're seeing a news article that, oh, you can use mushrooms in a medicinal way. You can do these different things. And so I think we've learned a lot over the years, and I've learned a lot over the last several decades about how do we work with this? How do we establish a program that's going to be here to help people, that involves people? So again, we're not just forcing something on people, we're actually doing this in a much more organic way. We're doing this in a way that's going to help meet needs, with also the understanding that we're not always going to be able to meet everybody's needs and everybody's wants. But we're going to do the best we can to have something that's going to be beneficial for the most people possible. And that's with keeping in mind that we still are dealing with psilocybin being a Schedule One drug as well, that it's illicit on the federal level, but legal on the state level. So part of it is also how do we help protect the people who are the practitioners, the cultivators, and most importantly, the patients, so that they're going to be able to actually engage with using psilocybin and having their journeys in safe ways, therapeutic ways, and that, for example, the cultivation, that's being done in a way that's safe for people to consume. So that's some of the different things that we're looking at. And as we move forward, how do we do this in the best way possible? And there's one main other point. How do we do this in a way where it does not just stay for those who can afford it? We have to talk about the equity and the access. How do we ensure that it is there for as many people as possible, regardless of where in life they come from, regardless of how much money they make? How are we going to be able to provide a program that is going to help people who otherwise have not been getting help? And with that, the cultural considerations as well, especially here in New Mexico, because we have so many different cultures, including Native American, Hispanic. We have these rich cultures that in many cases have been using other natural remedies or psychedelics in the past. And so, how do we honor those while still being able to move forward into the future?
Yeah, thank you so much. And how do we learn from them to help integrate some of their beautiful healing work that they're willing to share? And it's the collaboration, the partnerships are so important in this space. And thank you so much for that, Dominic. And tell us about you are the executive director for cannabis and psilocybin currently. Is that correct for the state?
The center director. But yes, so our center is a part of our public health division within the Department of Health, and our center focuses on medical cannabis and medical psilocybin.
Understood, understood. So let's talk about this. Let's talk about kind of the timeline. And I love that you bring the perspective of we've been talking about psychedelics since the 1990s for harm
Right.
reduction and the therapeutic benefits of it. How incredible. And I was notified about a bill that was written in 2023, and I took a look at that. And honestly, I couldn't stand behind it. I think not many people could. It just, was missing certain key points, especially with harm reduction. Well, I think that's a huge, huge point to be made that we have to be safe utilizing these medicines in whatever way that we're looking at it. In this case, the therapeutic benefits. And then looking at the bill again in 2025, I was like, who wrote this bill? This is amazing. So great. Yeah, so great. And then from my perspective, it was a really interesting, cool time of connection within the community, grassroots from all different levels. For me, it was the professional level with other physicians who reached out to me, knowing that I had been doing this work. There were folks at the End of Life Options New Mexico reaching out. And so we all were hyping each other up and It was a really cool time. We're showing up at the Roundhouse in Santa Fe, giving little notes, learning how the Roundhouse works, And it really was a magical moment that we all came together for this beautiful, unifying goal that you don't see it happen very often. And it was very magical. And now we're in a different place that's really amazing as well. What was that experience for you? Were you also in the throes of that? Were you more of the sidelines? Where were you with all of this?
Well, to kind of cover that, we have to go back to the memorial the year before in 2024. And what the memorial really required is it required that the Department of Health actually look into the use of psychedelics and psilocybin in specific. And so as that unfolded, and we had written a white paper, and it included community members, it included various other people within not just Department of Health, but other agencies. And that really helped to foster a lot of this is something that possibly could work. And now it's a question of, is it going to end up being legislation? And then that's where I really give credit to the sponsors, the primary sponsors of the bill. And there were quite a few on the House side, but also in the Senate. The primary sponsors were Senator Steinborn, Senator Hickey, and Senator Brandt. And this was something that it wasn't a partisan issue. So it wasn't just one party, because out of those three primary sponsors, two of them are Democrats, one is a Republican. And so it really came together on the House side. There were, again, several sponsors, Representative Liz Thompson, and you had several others, and there were both Democrats and Republicans who were involved in this. And so being at the Roundhouse then during that session, I was actually there as the Department of Health's expert witness for the senators in the committee hearings to be able to answer technical questions and to be able to talk about, if the bill passes, how would we be setting it up? How would we move forward? And so really got to talk with a lot of the advocates during that time. As you mentioned, in the hallway, you're getting to talk and getting to know people, but also being able to answer those questions in such a public forum. It was, quite frankly, it was very exhilarating, because here we have a program that has the potential to help so many people. And we were hearing from advocates and people who have gone and received treatments in other places, and hearing some of them, some of the veterans, some of the first responders, in how this really helped them. I mean, to the point where on the Senate floor, one of the senators is standing there crying. And just a couple of feet away from where I was sitting behind Senator Steinborn, and this senator is there, and you could feel the emotion. I mean, you don't really feel that through the screen when you're watching a broadcast, but being there in that room, you could feel his emotion and how he felt that this was going to be such a great program and help so many people, especially veterans. And just even feeling that from one of our state legislators and knowing this is a good track for us to be on. And so it makes me so honored to be able to be a part of this and to be able to help move this program forward. I mean, that's what my entire life has really been about, is about how do we serve people? I inherited it from my parents. My dad was a firefighter. I have brothers who are firefighters. I have other family who are police officers. So first responders within my family are a huge thing. And seeing what they went through over the years, and seeing what other people go through, our veterans, seeing the issues that they have to deal with, and hearing from other veterans, other first responders, how this medication, how a mushroom with psilocybin and psilocin in it, just has such an impact on them. How do we get that out there more? And how do we do it in a safe way? Because the concern a lot of people have, and it came up during the Roundhouse, and for those who aren't aware, the Roundhouse is our Capitol building. It is an actual round building. And so being in there though, and hearing this, and from advocates, it really highlighted, when we put our minds to something, we can get it accomplished. And we did. There were very few no votes in either the House or the Senate when the bill passed. It was overwhelming on just the emotions that were present there and how amazing it was for it to move forward. And then, as I kept telling the sponsors, now the hard work really starts, is because now we have to build a program. we don't have staff. We're starting. We now do have a program manager, and we're in the process of hiring two other staff members for it. And so the work that we've been doing up till now has been other current staff who are interested in it and who are helping us to build this program. And so we have some health educators, we have staff who are going to help as far as from a patient advocacy standpoint. We have our medical director. We have other people who are bringing in different expertise so that we can look at this and say, all right, we know a lot already, but the real problem is how much do we not know? And how much can we learn from our advocates, from community members, from patients, and getting out there? So we had already held several listening sessions in order to be able to hear what people wanted in the program. How was this going to work for them? And then we set up the statute requires, and we would want to have one, of course, an advisory board for this. And so we now have that, and they have started setting up committees or to look at different aspects of it. So those meetings are starting to happen now. In fact, we've already had in the last 2 weeks, we've had five of them, I think maybe
Mhm.
six. We've had so many I've lost count, but they have different areas like production, which includes cultivation, the testing that needs to occur to ensure that the mushrooms that are grown are going to be safe for people. We have a committee about research because it doesn't just end with, oh, we set up a program when we're done. We need additional research. Who else is this going to be beneficial for? What other areas is this going to be helpful? Because the bill starts out with four conditions: treatment resistant depression, PTSD, substance use disorder, and end of life. But as we know, as the research continues to develop, there are going to be other areas where psilocybin treatments are going to be effective and beneficial. We just need that research. And so, one of the things with the bill is it also allows for that research. And so, not only are we going to be having a program that is working for and with the patients to get the help they need, but also doing research in order to make sure that we can help other patients and other individuals who we don't even know need this help yet or that to see. So that's part of it that is so exciting to me. It's not a static thing. It's something that's going to continue evolving as we move forward. What are these journeys going to be like for the patients? What do we learn from them? Are there other ways to administer? Are there other things that are necessary or beneficial in it? And a lot of it is we've talked, and you and I have talked, it's state of mind as well. How do we help people get into the right state of mind for this so that they're open to the healing? And that's really what it's all about. And that was what was so amazing during the legislative process, even, was it was about healing. And that is so rare, I think, these days, but so necessary. So, how do we do this in a healing way? And not just the psilocybin, but even the process. So with our process, we're being very open. We have meetings, we post the recordings on our website, the documents that are there. We want people to look at it. We want people to comment on it. We want people to be involved. And so that's what we're doing.
It's
I don't know
fantastic.
if that,
No, it's perfect. It's fantastic. I love everything that you're sharing is so right on. And it really speaks to I had goosebumps you telling the story of the senator sitting next to you who's crying from the stories. And I think we were all being present and hearing these testimonials, and people were very professional about it. People were very heartful about it. You know, there was a lot of heart in this process as well as mind,
right?
really coming together and planning things. And the bipartisan part, like, it was, I mean, every committee that it went through was sweeping votes, bipartisan. We're all like, what, this is the coolest thing to be a part of. It's true history making.
Right. With that, there was one part where one of the House sponsors, Representative Stephanie Lord, she saw me out in the hallway waiting for one of the testimony periods. And she just came out and she said, "Are you here for psilocybin?" And I said, "Yes, I am." And she just reached out and gave me a hug. She's like, "This is fantastic. We need this." And so that's the kind of thing that was so important. As you said, the heart was there, the passion, the belief that this is something that we can do something good and positive for people. And we need that. We need that as professionals, as regulators, as everybody, individuals, the legislators need that. They need to know what they're doing is going to be impactful and beneficial. And this is one area where it's been very clear that everybody who has been involved has been going, how do we do this? And so in the bill, we actually had the deadline for getting the program implemented was set at December of 2027. And part of it is so that we can get things moving forward and we could do it in a safe, regulated way, ensure that the patients are going to have safety, that the locations where treatments are going to occur are safe locations and are well suited for it. But one of the things that became very clear very early on in those first couple of months was how much people are asking for this program and asking for the treatment. I mean, getting emails, phone calls saying, when is this going to start? Can you refer me to a provider? Where can I get psilocybin? How do I go about this? The amount that we were getting, it was just overwhelming, quite frankly, in a good way. But it
Mhm.
also was, we need to figure things out so that we can help people sooner. And so a decision was made, and that we need to get at least the start of the program. And it won't be the full program, but the start of the program. We need to start seeing patients by December of 2026. And I know there are some people who have concerns from the safety standpoint and all that. And I'm not trying to minimize that at all. I share those, but I share those regardless of what the timeline is. I want to make sure we have safe product, a safe program, that the medicine people are getting, that whatever they're ingesting is going to be safe and appropriate. And so we're going to do the absolute best for it. We're meeting with regulators from Colorado, from Oregon. Earlier today, we met with one of the labs that's already doing this to talk about what kind of testing. And we're doing a lot of homework and a lot of that due diligence to make sure that we learn from the other states that have already implemented. So, Colorado, Oregon, learn what's working well, what's not worked, what issues they've had, so we can help avoid those. We'll make our own mistakes. We're
Yeah.
human, we're going to make our own mistakes, and we ask people to be patient with us. But we're going to do things in the best way we possibly can. And part of that is this synergy with others. So especially through the committees and the board and hearing at different events. I know I spent I don't know how many hours just going out into the community at any and all events that were happening and really finding out more to see it's not just about individuals. It's also about the community. Who's involved? How is this going to affect the community? And really looking at all of that and trying to figure out how do we now take something that is very organic, something that really is when people are using psilocybin and their mind expanding, the plasticity in their brain and changing that. Now we have that hard task of now we have to take it and put it into a regulated program. And so it's sort of this dichotomy of how do you take something that really is sort of amorphous that's out there and now we have to put it in some ways into a straight line track, so to speak. How do we do that with still retaining that amorphous quality and allowing the patients to be able to go where they need to go without us restricting them and to be able to do what they need to do on their journeys and to encourage that in a positive way? I don't know if that's making any sense. Sometimes when I start getting talking about it, I think about how wonderful it really is and how wonderful it will be. And I want that to be right now. But I'm not going to sacrifice
Yeah.
safety and those issues to get it now. So we think that and when I say we, the other people within the program that we're hiring, that we've been working with, we're saying we're making that commitment. We're going to get and ensure things are going to be done in a safe way, but also to do them sooner because people need it. And we
People.
can't sit on the sidelines and say, well, what are we going to do? No, we need to do it. And in the beginning, the program's not going to have all the bells and whistles. It's going to be very streamlined. But then over that next year, we're going to continue to develop it. Like one of the things that people are bringing up is, well, what about using other products? Well, how do we test a product, for example, to start with? We're talking about a natural growing product. We're talking about a mushroom. From one mushroom to another, what's the amount of psilocybin that's going to be in them? We can't test every mushroom because then there's nothing for people to take. So we have to figure out ways of doing that. Do we go through a homogenization system where we take them and we essentially powder them and turn it into something that could be utilized as a tea or put in a capsule or some other way? Well, with some traditions, and especially on the spiritual side and some of the cultural traditions, people have expressed that they would like to make sure that they're using whole mushroom. But how do we ensure safety? We may not be able to do that right at the very beginning. We may have to say, these are the ways you have to do that. But be rest assured, we're not going to stop at that. These are just going to be the December of 2026 is going to be, we're starting to see patients. But as with anything, we're going to continue to improve it, expand it, have other options and other abilities for people to be able to use. I mean, I think of it sometimes, an analogy that I was using the other day with some people was it's like telephones and telephone technology. When we first started out, you had to have it plugged in the wall. Then you were using it, and initially, I mean, if you go back far enough, you had your earpiece and a mouthpiece separate, and now we have it down to where you have a simple little piece of electronics that not only can you talk with people, you can send them text messages, listen to music, take pictures. It now does so many things. And I see that as what we're doing with the program is when we first start it, we're going to have our earpiece and our mouthpiece, and we're going to start at that level, and then we're going to continue to improve it until eventually down the road, and not too far down the road, we get to the point where we have a much more advanced program and a much more comprehensive program.
It's beautiful, and it's wonderful that you are also open to and encouraging that the community be part of the conversation from the beginning. And I see us being able to evolve this program even with more refinement because
Yep.
of that. Because we all have blind spots and we all have also pieces of wisdom and truth and fractals of truth that have been given to us and we're sharing with our community, but we all have pieces of them. It's when you're bringing the community together and really hearing and listening and acting from that space that I see this refinement happening with more ease instead of a very top down approach. It has to be this particular way, even as far as, and it's wonderful that we have Oregon and Colorado ahead of us because we're learning from them so much, right? The piece about the requirement of the law in Colorado and Oregon is actually the state of Oregon. There's a lawsuit against them because they're not allowing people to go to people's homes who are disabled, especially at the end of life. You know, all of my hospice patients, not one of them could really get
Right.
themselves to a service center, for example. And so, even in those conversations when I'm popping in for a committee meeting, I'm like, I got a cent to share. This is what I'm seeing in the
Right.
community. It would be a privilege to go to someone's home who really needs this medicine and they need their family members to make them feel really safe in this very vulnerable moment instead of going out into a very sterile building, for example. And I'm not saying that's what we're doing here in New Mexico. I hope not, but maybe it's a combination of things, that we provide. I don't know, um, but to even being open to that conversation is a privilege to be in this state, truly.
Well, and you bring up a great point, and that is one of our charges in the statute is access. And people forget that all the time, where if you have somebody who is in hospice, I mean, it doesn't really matter if that center was next door or if it was 10 miles away. It would be cruel in many ways to say you need to go and go somewhere else. So we have to figure that out. Now, there are some things we have to figure out to ensure safety for others, but those are obstacles that we can overcome. And we're going to overcome them by really looking at them not as obstacles, but these are opportunities. These
Ooh,
are things that we can do of how can we figure out to do this better? How can we figure out to do this in a safer way? and to not just apply it with regard to psilocybin. So I see this as a starting point for us with psilocybin. Down the road, how do we apply this in other areas? How do we actually help to improve services in other ways? What kind of models can we use that are already there? And how could we use it in the future? One of the things we've talked a lot about, and it came up in one of the committee meetings, but I think we've talked about it even before, is New Mexico geographically having so many rural and frontier areas. There just aren't the providers in those areas because there's not the population. And so when we have areas like that, how do we get to them? Mobile, having people who are mobile is one example. So a provider who might go to somebody or go into a community specifically to be able to do treatments is a great idea. But even with that, we're going to miss so many other geographic areas and the people who live in them because it's just not a possibility with the amount of land space that we have in New Mexico. So we're looking at things and looking to ideas such as Project Echo, which is a virtual modality used for treatment, started out with hepatitis C, but is now used among all different kinds of treatment modalities and areas. And so looking at ways, how could we do a combination where we're engaging with the technology for using virtual means as well as that in person? And I think both of them can be very important, which I think is it's an interesting thing talking about a medication that helps to expand the mind and help people to go on these journeys. And we're talking about how do we do this also with electronics that's very modern. And I think that's that synergy between this historic cultural medicine, how we can use it in the modern day with modern technology, and making sure to do this in a well rounded and respectful way.
It reminds me of Maria Sabina. There's a story about her in Oaxaca where she was doing the rituals and the with the mushrooms in the 1940s and 50s. And I think she was made aware that it may become known in the Western world, that these mushrooms are the Santuninos, the little doctors going to come out, and they asked her, how do you feel about this? And the story is that she paused, she sat with it, and she said, well, if the mushrooms need to come out, this is their time, this is what they're asking for. And so it's really that integration of what we have now with these ancient medicines that have been around for millennia that translates into really the best recipe for all of us, not in those stuck ways of the past, not in only this futuristic technological work, but a combination of the in person and technology. I think that's phenomenal to be alive in this moment.
I agree. And as we continue moving forward, I mean, this is, yeah, and I know I'm here speaking on behalf of, but there are so many people who are involved in this. It really truly is. We're not just a village, we're an entire state that's really looking at this and moving forward. And we couldn't do it without the support. I mean, I talked about the senators and the representatives who really brought things together and really helped advocate for it. They still are. They didn't stop. It wasn't just the bill passed, the governor signed it, and they stopped. We're working on it through with the governor's office, and through our Secretary of Health. We're getting that support. How do we figure out how to do things? What can we do? How can we help allocate resources? How do we do all of these different things that have to happen logistically for us to be able to have a successful program? And so that support has been there, and and we wouldn't be able to do what we're doing without it. And so it's coming really on all levels. And we have people who, I mean, they email or they show up on a committee meeting and they say, I want to be helpful. They're committed to it and they're excited about it. And that just, I mean, one of my concerns, quite frankly, one of the opportunities I have to start to figure out a little bit more is with all of these people engaging with us and with the program, how do we continue to engage back and do this in that way that we're not just saying, oh, we need somebody to do this. Oh, we need an intern. We'll have them counting paper clips. No, what are we going to do that's also going to be meaningful? And so we're also being very conscious about that aspect of it is how do we move this forward in ways where people are doing work to help advance this in a meaningful way. And so what areas are we looking at? I've talked a little bit about cultivation and those other areas, but some of the others, and I know you are very familiar with it, is the education piece. And I didn't mention it earlier in the part because we were talking so much about things and I get so excited about it. But as I continued with my own schooling, I ended up becoming and getting my master's and PhD in educational psychology. So one of the things we need to look at is how do we actually build curricula that are going to be appropriate for the providers, for the patients, because it's not just about the journey. It's also about how do we help people with the preparatory, the integrative therapy, the therapy both, and again, the preparatory as well as after. And it's not just about you're going to meet with a therapist. We have to help train those therapists. How do we do so in a good way? How do we ensure that they are understanding what the needs are for people who are going through or have just gone through their journeys? And so we need to look at those curricula so that we ensure that we're doing this in a good way. And as we often see happens with curricula, people will say, oh, we need to have this part in there. And it has nothing really to do with it. It may sound good. And so when we develop the curriculum, we need to not just say, here it is, or here's the set of them. We need to be examining that. And that's a part of the research side of what parts of this are actually necessary, what parts of this are not. Do we need to require people to have a master's of social work, a master in counseling? Or can this be something that somebody who is a community health worker can be helping with this? What additional training do they need? What do they already get? So, what types of licensures or certifications are going to be helpful for the patients to do this again in a safe therapeutic way, but where we're not making something that's going to cost people tens of thousands of dollars to get education to be able to help others. I mean, the fact that we're turning around and saying people have to turn around and pay, I'm not even going to ask how much it costs to get your degrees, and I'm never telling anyone on mine, but
Right.
how much it costs. And how do we do this in a way that's cost effective, not just for the patients and how much the treatment costs? We're going to try to lower that as much as we can, but also for the practitioners. If we can't figure out a way to make this affordable for someone to be doing this practice, then we're not able to move this forward very much. It's going to be very limited, and that's a part of the equity. Equity and access don't just mean the patients, it also means the practitioners.
All across. And I love that you bring that up with our program. We did two things. So, one was we looked at the Colorado criteria of, bringing people on. And one of the things that they had in their bill and law, which I found very good, was that if you have over 1,000 hours of client facing practice, then you can apply for the certification. I adopted that into our program, into the Conscious Physician Psychedelics Academy. And it was really helpful that one of the members who meets, there's only one out of 26 who meets that criteria. She has a business degree from UC Berkeley, very smart individual, has had a couple of TBIs, which she's healing from and has healed from, and their doctors are like, wow. So we are actually developing a TBI protocol with her and with a occupational therapist who's on our, as part of our members as well. But, and then these things happen, and you're like, wow, this is really cool. No one's doing this anywhere. This is, in New Mexico, this is what we're doing. And she is a very valuable person because she has a lot of experience in art therapy. And so she brings in a whole different perspective to the rest of the members who have all kinds of degrees and letters after their names, And
Right.
she feels a little like insecure about it. And we're all like, no, this is phenomenal. The fact that you're bringing this up and the discussions are so rich because he exists in this cohort, and so for us not to exclude, but to really get into, hey, who are you and what have you been doing? And she's already been doing work with the medicine for people that's been very beautiful and a lot of wisdom. So I love that as well of having those conversations with people as an opportunity. And the equity part, I agree with you 100%. The average psychedelic certification course is between $10 to $13,000. We had to sit with that and be like, are we okay with that? Like, especially in a population in New Mexico, if we're trying to exclude everybody except for the 1%, like, what are we doing? So we came with a tiered program, the top tier 7,500 for the 9 months and retreat, and over 20 plus faculty that we have, guest faculty on board, who are doing this voluntarily, by the way. Um, then we have the 5,000, and then we have the access tier, which is $3,000 for the 9 months, the retreat, and everything. Everybody gets exactly the same. And so, talking about equity, we were very conscious about bringing that forward as well. And I love that. Thank you for thinking of it. And honestly, because it's in the bill, then it's on everybody's minds, right?
Right, exactly. And it's one of the things that, especially in the work that I've done all of these years in harm reduction and looking at that, it's one of the pieces that we have to always make sure is there. Are we listening to people? Are we meeting people where they are? And that equity part is so important in it. And so, yeah, so to me, it's a part of, well, that's just what we're doing. And that sometimes is a little dangerous because then sometimes we don't actually express it and we don't express that and so, because it
Mhm.
becomes just a regular part of what we're doing. And so one of the things that I've been trying to do in some of the various committee meetings and the other public meetings is really to ensure that if it's not getting expressed by someone else, that then I'm making sure to bring it up. We had one of the meetings where somebody in fact started talking about, and why isn't harm reduction in there? And I was like, yeah, that's exactly the right attitude. We're looking at it from a standpoint of course there's harm reduction, and of course we're going to have those equity pieces, but if they don't get expressed, they oftentimes get overlooked. And so we're making sure that those pieces are going to be included in.
It's beautiful what you guys are doing, and it's just so fun and so
Well,
interesting and so wholesome and really thoughtful how everything is being planned out. And I just it's a privilege to be a part of and also witness to this process. Thank you for leading it so beautifully, Dominic. It's not easy with so many players, and I mean we have 7 advisory board members that you gotta bring in. Okay, this is how we do it, and you do it in such a, I want to say, diplomatic but kind way, as well as, hey, this is the process. And I've been to all the advisory board meetings, and I'm now coming in some of the subcommittee meetings. And I watch you lead, and it's awesome.
well, thank you. Really, it's the entire team and it's all the people who are involved. I mean, it really, to me, it's an honor to be able to do this. And I'm just grateful that I am able to. Hopefully, well, I'm not going to hope. I know we are going to have a fantastic program. And I really am looking forward to that. I'm so looking forward to that first day when we can say we have now treated our first patients in our legal medical psilocybin program. And so when that happens, I'll be celebrating. It's gonna be
We'll be
phenomenal.
celebrating with you.
That sounds great. We'll all celebrate.
We'll all celebrate. It's gonna be maybe another gathering in the backyard. I
Yeah.
don't know. And Dominic, question for you before we
Yeah.
end. Our state is also very unique in moving the Psilocybin Medical Act. First of all, it's medical act, so it's that designation, and then also the fact that we went through a purely traditional legislative process. Do you mind teasing that out for people who are listening in from other states? I have people in Florida reaching out. How did you do this? Can
Yeah.
we do this from Kentucky, from Missouri, all over the place, who are potentially listening in and would
Yeah.
benefit from the education.
I would say every state is going to be a little different because their legislative process is going to be different. But I think what was so important about this is the sponsors really did the groundwork. They really did their homework on it. They had those conversations with the other legislators. They brought in the advocates. They brought us in to talk about the details, the stories, really to be able to talk about what an impact psilocybin has had on their lives. I feel like that was probably the most important aspect of it. This wasn't done, you mentioned before, like in a sterile room. It wasn't done in that sort of a sterile process. This was a very involved, heartfelt, passionate process. And I think getting and having that is a key to it. And then having language in the bill that is going to be appropriate, and this is where it gets tricky because every state, they have all of their different statutes and laws that fit together in different ways. And so there's not a one one size fits all sort of a method. Just quite frankly, like what psilocybin helps to do, it's about there are many different pathways, but I think it's more about intent, process, and really being, very very honest and open about here are what here are the positives about this. And not to say we know that there are some very small, very few times that there are negative reactions. You don't gloss over those. Talk about them openly and honestly. But what medication doesn't have that? I mean, I always go back and I think about the commercials on TV where they're talking about here are all the benefits. And then suddenly, in a 10-second burst, they give you 10,000 words at such a speed that nobody's ever going to understand it. Well, we don't want to do that. We want to talk about it openly and just as much reality as the positives and the benefits. And I think by doing that, we really reach two people, to whether they be other people in the general public, the legislators, the executives, the regulators, through doing that honesty and that passion and that talking about it. I
Mm.
think that's really what helps change minds. Now, you still have to back it up with the evidence. And so that's where then having that evidence and where us having done that memorial and writing that white paper the year before really helped with that. That was a part of that groundwork. That was a part of that. How do we establish that this is a medically viable treatment for people? Now that we've established that medically it's possible and viable, now we have to talk about the impact it has on people's lives and how people went from, as some people have said, zombies who really had suicidal ideation and other issues, and then they went through their journey and their treatment, and now they're saying, look at me, I'm out here, not only am I doing well for myself, I'm figuring out ways how to give back to others. And isn't that what we want? We want people who are going to be giving back to others and being a part of a community. And I think we need that now more than ever. And so how do we do that?
Beautiful.
So
Thank
yeah.
you. Yeah, that's so beautiful. And for me, the implications are so huge from what we are doing here, and we have already achieved so much in a short period of time, if you really think about it, since April, right? And we're really doing a great job. And for me, I'm from Iran, and as you know, right now there's a revolution happening in Iran against a regime, a terrorist regime that has tortured and controlled with fear of Islam and using religion. And the Persian people are not even Muslim to begin with, but as colonialists they came and they really severed us from our roots and severed me from my roots, right? I'm here
Right.
in the United States, thankfully, and I'm so grateful for it. But my service to humanity really stems from everything that you're describing too. That's why I'm here too.
Yeah.
Even through creating the program that I have, it's really ultimately we're going to translate it into Farsi. We're going to help the people of Iran and many other regions of the world where there is trauma and active trauma in Ukraine, in the Arab countries, in Israel, in all these places that heads of states have made decisions. And then the trauma that is bestowed upon the people on the ground is so severe and intergenerationally is going to affect all of humanity on our planet. And so, yeah, it's true service. This work is true service. And thank you for being such a huge catalyst for it.
Thank you. Again, it really just, I'm lucky to be where I am, and I just hope that I can live up to the expectations.
You already have.
Well, thank you.
Yes, yes. We just continue on. This is
Yeah,
fantastic. Well, thank you so much, Dominic, for your energy, your presence, your intelligence, your heart, and passion that you have for this work. It's really wonderful to have you be a leader in this in the state of New Mexico.
thank you, Lita. I appreciate it, and we couldn't be doing it without everybody else. It really is. And so thank you for all that you've been doing, and don't worry, I'll be calling on you for additional help.
Yes, I'm here. I'm here always. Thank you.
So
And have a
thank you so
beautiful
much.
rest of your day, of course. Thank you, and have a beautiful rest of your day. And
Thank you, Lita. I appreciate it.
yeah, of course, of course. Take good care.
You too. Thank you so
Bye.
much.